Welcome to Star Hospital's podcast. We have Dr. Rohini Kasturi, Senior Consultant Endocrinology. This podcast is about a very different topic, menopause in women. And how can women manage their diabetes pre-menopause, post-menopause? So let's ask the doctor. Doctor, tell us something about the patients whom you have reviewed who are managing diabetes and are also at the transformative phase of facing menopause.
There's a lot of changes that happen in a woman's body when they're going through menopause. Several hormonal changes actually. So the levels of estrogen come down, the levels of progesterone come down. So estrogen actually helps with insulin sensitivity. So it works with insulin to keep their blood sugars under control. So when the estrogen goes down, the insulin resistance goes up. Okay, and the other thing that happens is in the higher centers of the brain, the metabolism slows down. So when the metabolism slows down, again, higher chances of putting on weight. Okay, especially in the central part of their body. Okay, so that again puts them at risk for developing diabetes. So the other change that happens also is without the estrogen, bone loss. That's a big deal, especially in the first couple of years after menopause. That's when women lose a lot of bone. So these are all the hormonal changes that happen during menopause, and this altogether actually increases the women's risk of developing diabetes after menopause, risk of developing high blood pressure after menopause, risk of developing high cholesterol after menopause. So all these, factor into her health. So this is the time where, because of the lack of estrogen and the progesterone, she's having hot flashes, night sweats, and vaginal dryness and things like that. So there's several things that are happening at the same time. So this is the time where she has to be extra vigilant, take extra care so she doesn't develop any of these, effects from the menopause.
Okay, so let us look at it from two perspectives. One is women who are diabetic and who are likely to actually reach the menopause age. Let's say they are in the pre-menopause stage. What do you suggest for them versus women who are diabetic and have crossed the menopause stage? How do you want to differentiate between these two, and what do you want to advise them?
Right. So pre-menopause, there's not a whole lot of hormonal fluctuations happening. There's usually their cycle of estrogen and progesterone that happens. So things are more stable. Things are not like up and down. Okay. Whereas during menopause, because of all these hot flashes and these night sweats, because of the lack of estrogen and reduced insulin sensitivity, the blood sugar levels tend to go up. Okay, so they have, if they do not have diabetes, they have to make sure they get themselves screened, and make sure that they don't develop those things. Okay, but if you do develop diabetes, past your menopause, again, lifestyle changes are going to be the same pre and post menopause. But in post-menopausal women, we do take into account certain things, certain drugs that we tend not to use. Okay, there is a certain class of medications which actually can make them lose more bone. So those kind of things we try to avoid for them, and we try to also counsel them regarding high protein intake, because they lose muscle mass, they lose bone mass. So we try to educate them about in terms of lifestyle also, like a high calcium diet, a high vitamin D diet, and weight bearing exercise, and some strength training, so that they don't lose the bone mass as much.
So does it mean managing diabetes post-menopause is a bit more difficult than before? Can we say that?
Yes, it does get a little more difficult. It does get a little more difficult, but it just needs a little more attention. And with that, they can keep it just as well under control.
Okay. So typically lifestyle changes, what do you recommend? Especially for Indian women, you don't find them as physically active typically, but obviously they have a multitude of household chores to some of them continue to work. So what do you recommend as lifestyle changes for them?
So lifestyle changes, especially past menopause, strength training, and strength training, meaning weights or elastic bands and things like that, resistance training, along with cardio. Okay, it has to be a combination of two. Okay, and I would say 30 minutes of daily exercise for both pre and postmenopausal women. Okay, but a little more focused on the weight training, especially for postmenopausal. Okay, and in terms of diet, again, a healthy, balanced diet, I would say, with enough fiber, proteins, and healthy fats, and whole grain carbohydrates. And especially our Indian diets are, have too many carbs, and not as much protein.
Okay.
That is the main problem. So we need to make sure that the diet is balanced, okay, and that they have at least, the plate method is a very simple method that anybody can follow. Half of your plate should be vegetables and fruit, okay, and 1/4 should be carbohydrates, and the other quarter should be protein. So if you can follow that, that helps both pre and postmenopausal women. But with the bone loss that happens in the postmenopausal women, calcium intake has to be adequate. So dairy products, yogurt or cheese or milk, and sesame seeds, and things that are rich in calcium, green leafy vegetables. Okay, so these are very important, and vitamin D supplementation is going to be very important for the bone health.
Okay. So doctor, the other thing is how different is the approach in the treatment approach managing diabetes pre-menopause and post-menopause? Is there a difference?
So I would say the difference in postmenopausal women, we just try to avoid the medications that actually hurt them in terms of their bones and stuff, bone health. There are one class of medications that can actually cause bone loss. So we tend to avoid those medications for postmenopausal women.
Okay. And post-menopause, like you mentioned earlier, women have a different set of health-related problems to deal with, or body-related problems to deal with. For example, bone deficiency is one, and there could be possibly hemoglobin deficiency, etc. So what is your advice for women post-menopause if they have diabetes? How do they have to manage some of the other health-related concerns they typically end up facing?
So this is a phase where the body is actually slowing down a bit, okay, and the estrogen, progesterone levels are coming down. So they have to be extra careful in terms of keeping their blood pressure under control, cholesterol under control, because they tend to go up after menopause, and people who may not have had them, may start developing them, post menopause, and sugar might get actually a little higher. So their medications need to be adjusted, to reduce and get them back under control. And if they are facing, menopausal symptoms like hot flashes, night sweats, vaginal dryness, and things like that, those things also have to be addressed because they tend to affect their quality of life. So not all women are candidates for hormone replacement therapy, but everybody has to be evaluated in a systematic way, and if they do fit criteria for hormone replacement, we would offer it to them to reduce those kind of fluctuations for them.
So you've heard the doctor talk about diabetes and the management of diabetes in women facing menopause. So it's not very difficult. Women who are listening to this podcast, if you are facing menopause, it's easy to manage your diabetes condition. Little prevention, little do's and don'ts, meticulously follow them. You will lead a happy, healthy life. Thank you.